Hi, I'm Clare Barrington. I'm in the Department of Health Behavior. The challenge that our research is trying to solve is how to best support people living with chronic health conditions in the Galapagos. We were particularly interested in asking questions about how people navigate the healthcare system and how people manage the social and emotional burden of living with a chronic condition. So we were interested in engaging in comparative research with work that we had done previously in another Latin American island setting in the Dominican Republic, where we had interviewed adult men and women who had diabetes as well. We were aiming to understand how the context of Galapagos might be similar and what about the context would be different, and how that ultimately shaped the stress that people experience managing diabetes, as well as the navigation of healthcare services and needs for support. So we were interested in working in the Galapagos because there had been prior research done that established a foundation that we were able to build off of. Relationships had already been created with the local health authorities and communities, and there was some initial understanding of the multiple different burdens of disease that this population was experiencing. So we saw a great opportunity to add a qualitative, in-depth exploration of the lived experience of chronic conditions so that we could improve our understanding of how people are managing and maintaining their well-being as they have type 2 diabetes. We were fortunate to receive a seed grant from the Galapagos Science Center, which provided critical funding for myself and graduate students to travel to Galapagos to do the fieldwork for this study. We were also able to benefit from the existing research foundation that had been established by our colleagues from the departments of anthropology and nutrition, as well as the key relationships that had already been established with health authorities and other researchers in the Galapagos setting. So with the seed grant, we were able to support one of our master students to do her summer practicum, which gave her the opportunity to engage in an independent research project, experience a new setting and cultural environment, and also learn to navigate many of the challenges and opportunities that come along with doing global fieldwork. What we look forward to doing now is returning and disseminating our findings with the same local health authorities who facilitated us doing this work so that we can, together with them, identify ways to develop innovative policies and programs to support people in the management of chronic health conditions.